Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vazadeh.
And you have yet another success story
just launched by an East Bay fertility doctor.
Welcome to the Egg Whisperer Show. You guys, I am so excited to have one of the most famous OBGYNs in the United States on today's show. Dr. Shannon Clark, welcome.
Thank you. Welcome. Well, thank you for having me.
Of course. We go way back.
Mm-hmm.
The minute I saw you and met you, I was like, this woman is dynamite. Your message of positivity and the way you basically explain really complex things in really understandable ways for people just really resonates with me. So thank you for all the work that you do.
Well, thank you. And thanks for supporting me because that means a lot.
Of course. So I just want to tell you guys a little bit about this woman who's basically a superhero running around with a cape, saving mommies and babies all day long. She's a double board certified OBGYN and maternal fetal medicine specialist, focusing on the care of women with maternal and or fetal complications of pregnancy. After finishing medical school at the University of Louisville School of Medicine in Louisville, Kentucky, she completed a residency in OBGYN at Allegheny General Hospital in Pittsburgh, Pennsylvania. In her first year residency, she realized her passion for taking care of women with complicated and high-risk pregnancies and subsequently pursued a fellowship in maternal fetal medicine and master's in medical science at the University of Texas Medical Branch in Galveston, Texas, where she is an associate professor with roles as clinician, researcher, and educator, among so many other things. And welcome back to the show, Shannon. It's been great to know you through Babies After 35. And I love everything that you're doing on TikTok, Instagram to raise awareness about growing a family after 35. You're also a representative for the American College of OBGYN, working to educate people about the book, Your Pregnancy and Childbirth, Month to Month. I know it's a great book that talks about the topics in a very simple, approachable way. Tell us about the book.
So basically, this is the 7th edition of this book. The book has been out for a while, but they kind of revitalized it to update it to be more modernized based on, I think, having social media and the amount of information that's available through social media is surely a driver about how we even educate through other media sources like books. So modernizing it to fit that kind of style where people like to get their information. So we have the latest medical information on pregnancy and childbirth, new chapters, we have updated anatomical drawings, and more importantly, we have a lot of information on COVID-19, which is ever changing. So just as an aside, you can always go to acog.org and get more information on COVID-19 and pregnancy as it evolves over time. The recommendations in this book are supported by ACOG's clinical guidance. And for those of you that are listening that may not know, ACOG is the American College of Obstetricians and Gynecologists. It's kind of our governing body for how we practice obstetrics and gynecology. So it's from ACOG. The recommendations are from ACOG, and as well as practicing OBGYNs and clinicians. So that's what kind of separates this book apart from other books that may be kind of similar.
That's great because there's so many people out there that are writing books about pregnancy and childbirth, and it's really good to know that this is a trusted resource. So when patients ask me, Dr. Amy, what book should I be getting now that I'm finding out that I'm pregnant, I will now say Your Pregnancy and Childbirth, Month to Month.
Yes, and it is available on ACOG's website, and you can get it on Amazon as well.
Awesome. Part of the book also talks about best tips for things like diet and exercise. Can you share some of those tips with us?
So I think this is a really good resource because to be honest, and I've been practicing OBGYN and MFM for quite a few years now, we don't talk a whole lot about diet. Unless the patient is diabetic, then we get into nutrition and it becomes more important. So, just knowing what the basics are, what the basic food groups are, what's recommended, that staying away from sugar is not a must. Even if you're diabetic, you can still do it in moderation. So just giving you the basics about what the different food groups are, how you can achieve what's optimal in pregnancy for your diet. And then as far as exercise, that's one of the most common questions I get on social media. What can I do? When can I do it? And, some guidelines on what to do if you're already in shape and then you become pregnant, or if you don't have an exercise routine and then you become pregnant, or you're somewhere in the middle. What should you do? So if your OBGYN may not have the time to sit down and go through all of that with you, this is a good resource to have to kind of work your way through it and to kind of figure out what's the best approach for you for diet and exercise.
I love that. And then also related to discomforts in pregnancy, the book also shares some tips and guidance along that. What are some of the most common discomforts that you hear from your patients when they're pregnant?
So they don't necessarily call it this, but basically what they fall into a couple of categories. The first would be pelvic girdle pain, and that's anything in the pelvis. It used to be referred to as symphysis pubis dysfunction, or SPD, but now we kind of call it pelvic girdle pain because the pelvis is all interrelated to everything else in our body. And then you think about low back pain. Around ligament pain is a big thing because it's very common in pregnancy. And then lightning crotch, which people don't really know what that means, but that's a lot of pain where you get in the vulva and the vaginal area, some of that pressure, the sharp pains. So those are the probably most common pains and discomforts that you feel in pregnancy. So it's good to know what they are, what's normal, when to let your doctor know what's going on, and things like that. So this book is really helpful for things like that.
So lightning crotch is a thing, because I actually saw a patient the other day for lightning crotch and I didn't have a word for it. And she's like, Amy, it feels like someone is cutting me in my cervix. And I'm like, I wish I had a better way of describing that. And now I know. So thank you. That's pretty cool. So I also want to talk to you about what is one of your greatest passions, is educating people about babies over 35 and how things have evolved. So can you share a little bit with us, like over the last 10 years, how have things changed for women who are trying to get pregnant over the age of 35?
Well, I can't really comment on 10 years because I of course, was interested in it, but it really didn't become my passion until I was going through it, which would have been in 2013. So it's been 7 years. What's evolved as far as pregnancy and fertility over age 35? Well, we're having more people over age 35 and over age 40 who are getting pregnant and who are trying to conceive. We have more people who are delaying childbearing and anticipating delaying childbearing and wanting to know more about their fertility and what may or may not happen, what the risks are of delaying childbearing. And then also, if you do get pregnant after age 35, and especially after age 40, what are the risks then? So we have more patients, more people delaying childbearing, more pursuing IVF, especially after age 40, and having babies after age 40. So education and interest in education about fertility and pregnancy after age 35, and especially after age 40, is much more in demand now because we simply have more people who are interested in that.
And what happens to our fertility as we, get older, over age 35 and then over age 40?
Well, fertility, you think about, and you've taught me about this too, the decrease in egg quality, which is the genetics of the egg and its ability to join with the sperm and produce a chromosomally normal fetus. That just does decline over time because we're born with all the eggs we'll ever have. And as we age, they age. Unfortunately, no matter how healthy we are, and I'm a prime example, I started trying to have a baby at 39 and a half and then after 40, and I had no chromosomally normal eggs except for one that we got through IVF, and that transfer didn't take. And I had no medical problems. I had no medications that I was on. I was of a good weight. I was, exercising all the time. So it is what it is. I didn't have any chromosomally normal eggs. Then you think about how many eggs you have left to actually ovulate and then fertilize, and that declines over time too. So those are the two biggest things I think that people do need to know once they're in the boat of already trying to conceive, or if they're anticipating delaying childbearing, just to get educated on that and know the potential complications that they might have.
And are there different things that a woman, let's say 25, 30, 35, 40, 45, should be considering before she gets pregnant? Are the considerations different, let's say, for a 25-year-old versus a 45-year-old?
Well, I'm sure my considerations for having kids, I think about myself at 25, were a lot different than when I was 35 and 40, for sure. I think, as you're 25 and you're otherwise healthy and, having children or starting a family is not an interest to you, or it's nowhere on the radar. I think one thing that we need to do, even at an early age, is just start having those conversations with our OBGYNs. You don't need to talk about it once you're thinking about it or once you're ready. Those conversations can start way before that. So you can start getting information over time. I really think it should be something that should be in every well woman exam. This is fertility, not because you're wanting to have a child, but, about the future. Start getting that information as early as possible. Now, as you start getting past age 35 and especially age 40, if there are any chronic medical conditions, if you are not of a healthy weight, if you're on medications to treat any chronic medical condition, those are all things that, your medical conditions need to be as best controlled as possible. Trying to play catch up and get under control once the pregnancy is started is not ideal. I'm not saying that it can't be done, but it can be problematic, especially for things like diabetes and hypertension and any of the lupuses or any of the rheumatologic types of diseases, or especially if you have kidney disease as well. That can be very hard to play catch up in pregnancy. So if you're anticipating trying to conceive and you do have chronic medical conditions, if you're on medications, if you're not of an ideal weight, start addressing that now in order to try to minimize or mitigate the potential complications you might have once you become pregnant.
And I love that you say all that, because that's really the same message that I have. A woman should not be asking about her fertility when she's 39. That's just not fair to her to like, I'm ready now. And it's like, then I have to tell her it doesn't seem, it's really hard to get a good egg once you're over the age of 39 and have that be a shock and a surprise. It's not fair.
We drill into patients pap smear, STD testing, safe sex, breast exam, mammogram. When are we going to start drilling? Let's talk about your fertility. And I have to be honest, and part of my story is my personal story too. Part of the reason why I'm on social media and doing what I'm doing is because I went through what I went through myself to get a family. When I was 25, when I was 30, when I was 35, I did not think I wanted to have kids. In fact, I thought I didn't want to have kids. And I was perfectly fine with not having a family. I was ready to go solo and never have a family until I met the right person, and everything changed. So just as much as, being child free and choosing that life is perfectly fine, you might still change your mind. I know I did. So because of that, knowing where you stand in your fertility, there's nothing wrong with having a conversation and getting more education. All it's going to do is empower you.
Right, exactly. A fertility screening should just be right up there with cervical cancer screening, breast cancer screening. It should be part of the Well Woman Check, just like you said. And same with guys too. I mean, getting a sperm test is so much easier, and freezing sperm is so much easier than freezing eggs, for sure. So once pregnant, you're 35 and up. How is that pregnancy different than compared to someone who's, let's say, 25?
So let's first talk about why 35 is really the magic number, other than, and let's just back up a little bit. 35 has gotten to be this bad number when it comes to women and individuals who could potentially become pregnant. Yes, your egg quality and quantity do decline over time, but it's not a one size fits all. It's not like Dr. Amy or myself can pull up a chart and it says at 35 you have this many eggs left, and at 35 this many are chromosomally normal. At age 40, at age 41, it's not a one size fits all. It's different for everybody. Okay, so but I feel like it's kind of gotten a bad rep that at 35 it just tanks and there's no way you're gonna get pregnant on your own, and that's simply not true. There are ways that we can assess, and there's things that we can do to see where you stand. And even though I educate a lot about the potential pitfalls of waiting, I also want to balance that with saying there's plenty of people who get pregnant successfully after age 35 and after age 40. What I don't want is people to be surprised about it or assume they're going to be okay and not do anything on the front end to try to educate themselves and be prepared. So that's kind of what, and I'm sure you agree with me, it's kind of being prepared and being educated so that it won't be kind of a slap in the face when you're 40 and you have no eggs left, kind of like it was for me. So, that's the one thing I want to say to get, first and foremost. I don't want it to be, I don't want to be a Debbie Downer and make everybody think that I'm, putting a big curse on your fertility when you're 35. But when it comes to pregnancy, the reason why 35 became advanced maternal age or geriatric pregnancy and all those very sexy terms we call women and people who are pregnant after 35 is because when we started doing amniocenteses to check for Down syndrome, which is one of the more common chromosomal abnormalities that can happen in pregnancy, we found that the chances of having a baby with Down syndrome were roughly equal to the risk of an amnio at age 35, okay? So that's why it was considered advanced maternal age, because of that alone. Now, there are plenty of 35-year-olds who are perfectly healthy and do just fine, but based on age alone, even if you're healthy and have no medical conditions, you're not on any medications, nothing's majorly wrong, you're still at increased risk for some things: preterm labor, diabetes, preeclampsia, cesarean delivery, placenta previa or placental abnormalities as far as whether it's implanting on the uterus, and cesarean delivery. So those are still things that we have to consider for someone over age 35, regardless of what their baseline health status is. Now, if you add on pre-existing medical conditions, medications that you're on, and other things, then that kind of adds the risk on. And that's something that we need to be aware of as obstetrician and high-risk maternal fetal medicine specialists. So when I talk to people about pregnancy and the complications, you kind of have to go through a few hurdles. The first is get the antenatal screening to see what your baseline risk is based on the antenatal screening that you choose to do, because there's several things we can do to see what your risk is of having a pregnancy with a chromosomal abnormality. Once that's cleared, then we get to the anatomy scan, looking at all the parts of the baby to make sure there's no major defects or anything else. Then once that's kind of done, then we just look at what the risks are based on your age alone, and then if you have any other chronic medical conditions. Now you can, just because you're older doesn't mean you're destined for a high-risk pregnancy, okay? But you maybe still be considered that based on age alone, but don't be offended by it. Just know that you're going to have a little bit of extra surveillance based on your age.
I call it VIP, a very important pregnancy. Once you get past 35, you're just VIP. That's it. People just need to watch over you. Exactly. Just a little bit more monitoring, a little bit more checking, and that's it. I mean, the way I think about it is, my grandma had kids in her teens, my mom in her 20s, me in my 30s. Most of my patients are over 40. Our kids are probably going to have kids in their 50s. I mean, that's kind of the trend that I predict. And as a high-risk OBGYN, is that something that you're like, that should be fine as long as people are healthy?
It's an individual choice. You have to think about not only your health as the person carrying the pregnancy, also the health of the baby, and then longevity. I mean, listen, I think about that, and I'm not judging anybody that has children later in life than even I did, but I had them at 42 or almost 43. I was 9 days shy of my 43rd birthday, and I think about that. And so even though I love them and we're going to have a great life and all of that, I do think about, how old I was when I had them. I'm going to be completely honest. I do think about that. So, it's a personal decision that someone has to make based on what's right for them. So I don't think it's my job to tell somebody that they're too old. Now, if they have medical conditions, or they're not of an ideal weight, or they've had surgical complications, or they've had poor pregnancy history in the past, of course I'm going to give an opinion, because that's my job to give an opinion based on that, but not just based on their age alone.
I mean, we don't discriminate against men. Men can have babies and be fathers without ever carrying a pregnancy at any age. But I love your answer to that. So right now, obviously, we're in a pandemic and everyone's concerned about COVID-19, and the book that you're here to talk about also addresses that. Are there special considerations for women over 35 when pregnant related to COVID-19 that they should know?
No. COVID-19 and pregnancy is COVID-19 and pregnancy, no matter what the age. We have not found, now, of course, we're still relatively early. And although it seems like it's been ages that we've been in this, when it comes to research and getting data and finding outcomes with something like this, it takes years to get that kind of data. And we won't know that for sure for probably several more years to come. But as far as we know right now, there's no difference in adverse outcomes with COVID-19 and pregnancy based on age. It's just COVID-19 and pregnancy for anyone could potentially not be good, no matter what their age is.
So tell us, where can people find you, where they can find the book?
So the book you can get on the acog.org website. You can also get it on Amazon. It was being pre-ordered. You could pre-order it up to January 26th, so you should be able to order it directly now. And then for me, I'm on Babies After 35 on Instagram. That's where I'm most socially active and have the most engagement with my followers. But I'm also on TikTok, and I have a little bit of engagement there. It's fun to make those videos and share them on Instagram and on TikTok. So although someone told me I was a really bad actor the other day and I needed to hang it up, and I didn't really like that comment, but whatever.
Oh, it's probably your sister. My sister does that stuff to me all the time. She's like, look at your hair. I can't believe you're doing that. She's like, you're not funny, and stop wearing that dress every time. So I would take it as a compliment that they're paying attention. I think that's awesome.
Right. Yeah.
Awesome. So is there anything else you would like to share with our audience today?
No, check out the book. When you go on Amazon, there's some things that you can get as far as additional information to see if it's the right book for you. But it's not that expensive. I wish I could tell you the exact price, but I don't remember. But it's compared to other books, it's not much more expensive than that. But I do think it's something that, especially because the information is coming from medical professionals, that it really is something that people should consider getting.
So the title of the book is Your Pregnancy and Childbirth Month to Month. Thank you, Dr. Shannon Clark, for taking time out from your extremely busy schedule to join us today on the Egg Whisperer Show. We hope you'll join us again soon.
Thank you.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.